Have Eneida and Brett, who are both PA students at UVU, which the UVU PA program is just a couple years old now.
Mm-hmm. Yeah, we're their second cohort, and in January they're starting their fourth, actually. So
that's awesome.
Yeah,
awesome. We need good PAs in medicine. So Anita, how did you get into PA school? Like, what was your background?
So I was a surgical tech, or am. I still work PRN at one of the hospitals locally. And a lot of the neurosurgeons I worked with kind of just encouraged me to pursue PA school and kind of go further, and just helped me along. And I saw the role of the surgical PA and thought that would be really cool because I love the OR and I would get to do more. And I never really got to see my patients full circle. As a surgeon tech, they come into the OR, we operate, they leave, and then I don't know, like, how are they healing? How are they doing? How are they feeling? And so with the thought of becoming a physician assistant, I could see them preoperatively in the OR and then follow them on their recovery and kind of see how they're doing and kind of get more of like a full circle, complete picture of how we helped our patients. So that was really appealing to me.
Brett?
So before PA school, I kind of did everything. So I was in EMS. I had an opportunity to work with the Jaguars, the Jacksonville Jaguars, for a little while.
Really?
I did a lot of clinical research, and I just kind of felt like I didn't fit in any of those things yet. I knew I wanted to be in medicine. I just didn't know what that path would be. And I had a family friend who's a PA, and I got to shadow her a few times and hear what the job was like. And I realized that, like, I guess I went to shadow with her in the ER, and like I realized that day, like, this is what I have to do. Just kind of on what you were saying, like seeing everything. Normally what I would do is just bring someone in the ambulance and, like, you know, that's it. But to see what, like, the post care is like, and just that deeper knowledge base, just, yeah, I never look back. So
that's awesome. Yeah. I've been impressed with the experience that the PA students have prior to going into school. I had not even a fraction of the medical experience that you both had prior to medical school. And it's really special to have that background. So in PA school, what is, like, your day-to-day life look like?
It's a lot of studying and then finding opportunities to learn. Like, now that, at least for me, that I'm in my clinical year, getting to see things hand-on really kind of helps formulate, like, the full picture and how things actually work. And then when I come across, like, a time where something doesn't make sense, I just, like, note it down and have to go home and, like, review that and be like, I can't get caught again not knowing that answer. That was pretty embarrassing. So just trying to
that
absorb.
Doesn't go away completely, by the way. You still have to go look stuff up.
Yeah, it's just absorbing as much as possible and trying to not fry my brain as much. I feel like it just, like, poops out on me sometimes, and I'm like, oh god,
that doesn't go.
Can't do that right now. We don't have time for that. We got to be fully charged. But yeah.
Yeah, I'd say it's different this year. Like, being in clinical, so didactic, it was like 9 to 5 studying, right? So now, you know, we're in the hospital 9 to 5, and then we go home and study. So it's, you know, it's just a different, like, day-to-day lifestyle. But it's a bunch of studying. But I'm sure you feel the same way. Like, I love it. I enjoy reading about everything. So it's not a hassle in the slightest, but yeah, it's day to day.
I was a little bit surprised when I went to the University of Iowa. The PA students were in the same classes as we were.
Yeah.
And then afterwards, they went and did a lot of the same rotations. And so the PA training and the physician training was similar. The biggest difference was they had to learn it faster because it's a shorter, a shorter period of time. So I almost think that the PA student timeline and demands were every bit as high or higher than what the medical school students were having to do.
One of the most helpful things for me on rotations as far as learning has been, like, the patient education counseling part. Whenever you go in with your, like, assessment and plan and present it to your patient, like, having to really, like, inform them and educate them on it, and, like, the pros and cons, and this is what I think, this is the plan, this is plan B, your options, like, what works best for you, what would you like to do? That's really helped, like, solidify things versus just kind of, like, knowing the things and here it is, because they have so many questions and then you have to be able to answer them, and I'm like, that's a good good thought. I'll get back to you.
Yeah.
But it's been good. It's been fun.
Yeah, and although like our education, like in some ways is very similar, like I do like the collaborative effort that we have as PAs with doctors. It's we don't know everything, right? And I just like the fact that we have our MDs and DOs and whatever to come to if we have questions with.
I really
outside of
like that too, because the reality is the doctors don't know everything either. And I work in a team with a group of both 2 PAs and 2 nurse practitioners, and I think we've come up with much, much better solutions in collaboration with each other than I would have come up on my own. So that collaborative team working to help the patients, I think, is a good model for medicine, and it's getting better and better as the training is more broadly available, like with UVU's new program for PA school and also for NP school. There's more really, really solid, good people going through these programs and coming into the ranks and able to really help us out. Question, a little bit of a challenging question. So patient comes in and they don't want to see the PA. They don't want to see the nurse practitioner. They just want to see the doctor. What would your response be to that? What would you tell that patient?
Depending on availability
Okay.
of the doctor, kind of lets them know their options, right? So if they're not like at the facility or it's not an option, then it's kind of like, we're here, we can help you if you'd like, or you can come back and reschedule when they are available on their schedule. If they are available and they are willing, then I think whatever makes the patient most happy, most comfortable, especially with like so many healthcare options and choices. We don't want to be like a mean office, right, where it's like our way or the highway, because they can just go somewhere where they like staff or prefer staff. But also they might not understand the differences between like PA and MD and DOs and NP. So sometimes when they hear like physician assistant, the word assistant, they're thinking they're not going to be talking to someone who can actually help them. And so kind of letting them know that we will be able to help them and we can still collaborate with the MD and take back their concerns and kind of just figure out what works best for them in that moment and kind of go from there.
Yeah, I think it's like 2 parts, right? Like it's patient choice. So if they decide that they would prefer one provider over another, I'm happy to help you with that. It doesn't your credentials don't necessarily matter to that point. It's just your preference, and that's fine with me. I think the other half of that is education, kind of what you touched on as well. So I think there is, and I've experienced it already. The confusion between either what is a PA or PAs being confused with MAs or medical assistants. So I think a little bit of an education goes a long way with that as well. But yeah, I think just approaching it like, it's whatever you like. If you prefer to see someone else and you're more comfortable with that, regardless of your credentials, absolutely, let's make that happen.
So I've been in practice for coming on 10 years now and been in medicine for 20, right? And knowing what I know in my experience, I would want to go to the PA. Because there's a level of attention and value, and it's a different type of connection. There's the PA is not intrinsically motivated the same way that the physician might be. Like, I'm a surgeon, you're making your money doing surgery. And not that we try to be motivated by that, but it's kind of the reality. It's really hard for me to spend the kind of time that a PA could spend with a patient. And then there's aspects of the care that I don't have a lot to do with. Specifically, for example, postoperative pain. The PA and the NP in my practice is the one managing postoperative pain. And the conversation had with the patient specifically on what's going to work for you, what specific medications have worked in the past, what are you on now. Other conversations around preparing for surgery, explanations about what the surgery entails, what the risks are. It's almost like a internal secondary opinion or internal validation of what's going on. And this idea that I don't want to see the PA, I just want to see the doctor. I think it should be more of, I'm seeing a team and they're working together and both add value specifically with our conversation this morning on lower back pain. Lower back pain is a complicated problem. It's comes from a lot of different issues, right? And there's not one solution for it. Infrequently and sometimes a surgery can come in and really change the trajectory of a patient's lower back pain. But most of the time, the solution is a long-term management strategy with multiple facets. And there's no way that a single provider of any kind could deliver that. And so we have to be thinking about care teams and groups of people working in collaboration with the patient in the management of these kinds of issues. So, but I commend you for taking the leap. I think it's a little bit of it puts you out of your comfort zone. It's a little scary when you're in a niche that you're comfortable in, that you have an ability to add value, such as a EMT or a scrub tech. You're in the trenches, you're working hard, you're collaborating with others. And I think a lot of people are in the situation where they wonder about getting more education, and I think it's wonderful to see many, many people choosing to go and do that, and then be able to have even more ability to make a difference. So I commend you for doing that and for getting on camera and
Thank you.
sharing your thoughts. So thank you for coming this morning.
Thanks for having us.
Yeah, it was fun to be here.